So, hello everybody. My name is Richard Polin. I'm from Columbia University in New York, and I'm pleased to be the moderator for one of the sessions at Hot Topics 2023. The title of my session, which will be Monday morning, is A Double-Edged Sword of Antibiotics for Early-Onset Sepsis. As you know, for all clinicians who practice in the NICU, identifying babies with sepsis is an important clinical problem. And in general, we're not very good at that. We rely upon historical information prior to delivery, the baby's clinical condition, and some laboratory tests, and then decide whether to initiate antibiotic therapy or not. But only 2% of blood cultures are positive when we draw them for early-onset sepsis, which means 98% of the time we're starting antibiotics for infants who have negative blood cultures, most often because they're not actually infected. So this session is designed to help clinicians think about whether to begin antibiotics in babies with suspected sepsis. We have three great speakers. We have Eleanor Malloy, who's going to talk about diagnosis of sepsis. And if I asked you, how do you diagnose sepsis in babies, you'd probably say a positive blood culture. Well, that may not be sufficient because some babies have transient bacteremia. Others might say based on laboratory tests or based on historical information, clinical signs. None of those are very good at identifying which babies have sepsis, and Dr. Malloy will give us the most current iteration of how she approaches babies to diagnose sepsis. We also have Dr. Michael Markowitz, who's going to be talking about the NANO trial. This is the largest randomized clinical trial ever done to examine whether it's important to give antibiotics to babies with certain risk factors for sepsis, most of whom are going to be symptomatic, or to give a placebo. The study is enrolling babies 23 to 30 weeks gestation, and Dr. Markowitz will describe the endpoints. And finally, we're going to have Dr. Jiva Sankar talk about the development of antibiotic resistance in babies who are treated for early-onset sepsis. If treatment of babies with sepsis was benign, we'd start antibiotics in everybody. Unfortunately, there are side effects to using antibiotics, some short-term like necrotizing enterocolitis and late-onset sepsis, and some long-term as the child grows, like metabolic syndrome, asthma, and eczema. Therefore, we need to think carefully when and which baby should receive antibiotics. I think this session will help clarify some of those issues. I'm excited, and I hope you can join us.